Okay, what is the most likely explanation for this patient's renal dysfunction? An AKI due to nephrotoxic medications, chronic kidney disease due to hypertension, interstitial nephritis, prerenal azotemia due to decreased cardiac output, and renal artery stenosis. We've got a 70-year-old woman with a history of congestive heart failure presenting to the emergency department with increasing dyspnea, orthopnea, and peripheral edema. She's found to have elevated JVD, bilateral crackles on lung auscultation, and a 3 out of 6 systolic murmur at the left sternal border. Laboratory tests reveal elevated BUN and creatinine, and urinalysis shows a low sodium concentration, urine sodium concentration, and a high urine osmolality. Okay, I'm gonna try to break this down. So we've she's not she's got dilute urine, and high urine osmolality. Oh, no, I'm saying that wrong. No, she's got not dilute urine, but there's not sodium in the urine. She's clearly has kidney problems. She's got congestive heart failure and she's older, but this is an acute issue. Um, Bilateral crackles on lung auscultation, elevated jugular venous pressure, and the murmur all fit with the congestive heart failure, which usually can lead to some sort of kidney failure. Um, Let me think about this. I think because it's an acute issue and we're going to have some decreased cardiac output because it's all going into edema. So I'm thinking it might be prerenal azotemia due to decreased cardiac output because that's an acute kidney issue.
Okay.
But
Final answer.
I'll go with it. I may be wrong.
No, beautiful. You worked through that beautifully. So you have to connect everything together, right? Old woman, right? Congestive heart failure. So you have a risk there, and then you're in the emergency department, right? So it's an acute issue, like you're saying, right? So it seems like she has acute congestive heart failure, right? Even though congestive heart failure is a chronic thing, you have something called acute on chronic, meaning exacerbation of the congestive heart failure. Now, obviously, you have all these, nasty signs, right? Pressure's building up, crackles, you can't breathe because she's like drowning, right? And
Hmm.
then now, because it's an acute issue, she also has increased BUN and creatinine, meaning her kidneys are a little bit hit, right? Because you're not having enough cardiac output because you're kind of flooding yourself, right? So yeah, so everything fits here is because of that decrease of cardiac output causing pre-renal azotemia, meaning that there's less blood flow to the kidneys, causing some kidney damage. So yeah, perfect.